Hi folks, this is Kipper with week two's lecture, or the chapter on preliminary evaluations, which is chapter 2. I guess it's technically week 3, so ignore that first bit there. But this week we're going to talk about preliminary evaluations. To give you an overview of what they are, what example methodologies are available to you as part of a preliminary evaluation, and some of the most important aspects of doing preliminary evaluations. The one of which we will spend the most time on is kind of engaging stakeholders, identifying them, and knowing how to interact with them throughout your evaluation. So for the kind of first thing we want to talk about is what are preliminary evaluations. Now, preliminary evaluations are not necessarily always evaluations in kind of the truest sense of the word, but sometimes they're referred to as like needs assessment or formative evaluation. They go by a variety of names in the literature. I chose preliminary evaluations because I think it conveys most accurately when and why they're being conducted. And so those whens and whys are generally to answer some of the questions you see on the screen now, like what needs to be done, what is being done, who is doing what, and what should we do, what factors will impact we do, is it the right time to do something, what is being done in other places, and what works and what doesn't work. And so all of those questions can be explored through preliminary research methods before you even plan your evaluation or before you even plan the program which you're ultimately going to evaluate. And so research can help answer these questions to guide what best practices you should follow in both your evaluation and in the ultimate development of any programs within a health system. And so in thinking about which method to use and what to do, as I mentioned, there are a variety of methods, and I won't go into great detail on them in this video because I think that just takes a lot more time. These are described in some detail in text, and then also at the end of the chapter, there's an example of each one of these methods. And so I hope that you'll look at those examples so you get a kind of good idea of how it's being done. Now, it's important to recognize that the way these methods are used isn't always consistent from study to study. And indeed, sometimes you have to just take pieces of things that you think will work and put them together in a way that you and your stakeholders find useful. And it's important that you consult your stakeholders, both as you use these methods listed, as you use other methods, as you revise methods, to find out what will work best for them, what's going to match their level of engagement. Because some of these methodologies you can do alone, basically, as an evaluator, conduct a literature review or a document review. And some of these require participation from stakeholders. And so figuring out what level of investment you have from stakeholders, from your sponsor, is an important step. And so my recommendation is kind of the old adage, if the shoe fits, wear it. And so find what works for you and in your particular evaluation. And that's what you get to do as an expert in public health care and evaluation. Anyone can find a methodology and just follow step by step. The creativity that we look for in public health evaluation and research is to be able to identify and mix and match and find what is best suited to get the information you need to make actionable decisions. And so preliminary evaluations are basically set out to help you make those decisions that are relevant to planning, implementation, and evaluation. And so kind of as that first thing that I've mentioned is consulting stakeholders, the first question that might come to your mind is, well, what are stakeholders? Now, you probably, throughout your program, heard about stakeholders a lot, so I'm not going to push it a whole lot. There are many frameworks that you've probably been exposed to throughout your time in the MPH program, throughout your time in just working in public health. And I think each sector kind of in each even subsector, in each institution within each subsector for that matter, is going to use a stakeholder framework that works best for them, that is most relevant to kind of their specific sector. And oftentimes, it's really not that hard to identify who the stakeholders are. If you've been in an industry for a long time, you basically know who all the major players are, and you probably don't need to put a whole lot of thought into who you're going to work with, who's going to be concerned with your results, and that sort of thing. But if you're going to an area new, such as an area that's new to you, such as you might be doing, say, in your practicum, I think it's important to think through about a broad base of who are the stakeholders, who are the people that are able to influence and impact your work, and who are the people that are interested in the work you're doing. And so this 7Ps framework of patient-centered outcomes research, or PCOR, is one of the frameworks that exist, and it's one that I particularly like to help me think through a specific issue and identify who are the key stakeholders in that issue. And so you can think of like patients in the public being basically whoever you're outreaching to. This need to be like patients in like the hospital setting, you know, nightgown sense of the word patient. Often patient-oriented research often includes a broad array of people. So if you, for instance, do STI testing, right? Your patients may be a whole population of people. They don't necessarily need to be sick or need to be anything, but patients can be people you're working with in a preventative way. And so that patients in the public can sometimes be very broad. Sometimes maybe you're dealing with a very subgroup, subpopulation, or subcommunity, such as you're developing targeted and tailored care to Indigenous people, for example, right? Your stakeholders aren't necessarily all people in British Columbia or all people in your geographic area. Maybe the patients you're most concerned with are a specific subgroup of people, members of a specific First Nation group, for example. You'll also be concerned with the providers that you work with, and this could be individuals ranging from the nurses, the physicians, counselors, pharmacists, all these individuals who play a role, secretaries, all of that sort of thing, that play any sort of role in the implementation of an intervention. On top of individuals, you have organizations, and so these are like hospitals, clinic, community health centers. This includes boards and governance entities like CEOs, CFOs, doctors' organizations like the divisions of family practice, people who run continuing medical education programs, all that sort of thing can kind of fall under providers and are things that you want to think about and who you should be involving in your project. Because, yeah, maybe you can implement a project just fine and well without some of these stakeholders, but bringing them in will definitely increase the vitality, the scale up, make knowledge translation easier. And so it's really good to kind of think broad of who might be involved. And then we get into things like purchasers. So if you think of in a healthcare setting, there's people who have to actually do the purchasing of equipment and medication and that sort of thing for it to work. And so involving those people as stakeholders in your work will definitely make things go much easier, because for one, it kind of acts as an opportunity for knowledge translation to those individuals, but also helps you to identify hidden barriers. You know, if you're advocating for something like expanded access to antiretroviral drugs to fight HIV, right? Knowing which drugs are currently in the drug formularies, which are kind of the list of drugs that provincial health insurers will provide, is important. And also knowing which drugs maybe they're willing to add to their formularies, which drugs they're not, maybe due to cost, maybe due to some other kind of political element that you might not be aware of. And so engaging those purchasers and payers is really an important step in identifying your stakeholders. Then, of course, there's policymakers, and so this ranges from health authorities to provincial legislatures, ministries of health. When you're engaging with policymakers, you want to make sure to both engage with policy analysts, so that's kind of maybe your lower level people, all the way up to the minister's office of a specific health. So this might be the Ministry of Health. If you're looking at something like gambling addiction or alcohol use or something like that, then you might also look to other ministries outside the Ministry of Health. If you're dealing with traffic, maybe there's a Ministry of Transportation you need to deal with. And so thinking about who are the key governmental ministries that you'll bring into your work, I think is a key part of stakeholder identification. And I think just practically speaking, you're not always able to necessarily get all the attention of the minister, but lower level directors, analysts, those sort of people are great to include on your team, because they will often be the most available to help you, most available to interact, most available to engage, but also will have still quite a bit of sway and understanding of the environment, what the minister's office is thinking, and that sort of thing. So engaging with policymakers is really a key strategy for the work of identifying stakeholders. And of course, also product makers. And so people who make drugs or devices are important. Sometimes you can get sweetheart deals from including these people as stakeholders. sometimes there's kind of hidden benefits of them participating. And so it's really important that you think about these people, even if sometimes you feel like your work isn't necessarily perfectly aligned with their interests. Sometimes it's good to at least engage them and try to get a sense. You do have to be a bit, I guess, discretionary. I mean, in some situations, you might not want to involve certain stakeholders until maybe a later time. And so that's where you start to think about stakeholder analysis. Now, in stakeholder analysis, one of the most common stakeholder analysis frameworks is this classical kind of 2x2 table that measures stakeholders based on how much influence they have over either your work, the sector, or your other stakeholder groups, and how much interest they have in your work. So you can think of an organization that doesn't have a lot of influence and doesn't have a lot of interest. You can monitor them and keep tabs. They can definitely be a stakeholder that you're concerned with or want to pay attention to, but that you're not necessarily going to incorporate in all of your decision making, that you're not going to publish reports for, that sort of thing. But somebody who's high in influence, but maybe isn't interested, sometimes it's good to consult with them, to reach out, to see if you can get them on your side, especially if they have influence over other stakeholders. It's a great way to get other stakeholders on board. If you can get the name of a big respected organization, say something like the WHO or Health Canada or the Public Health Agency of Canada, if you can get them on board, it might attract other stakeholders to think, oh, well, I think they're going to be interested in this work because look, PHAC's in this work. And so definitely it's good to consult those organizations and to kind of bring them on board to see what you can get out of them. You should never feel too bad if a stakeholder who's low in interest doesn't really want to consult or doesn't really want to kind of engage too deeply in your project. But it's definitely worth the try to engage these people. When you have stakeholders who are very influential and they have high interest, these are the people that you need to be involving in decision makings around your evaluation and around the research you conduct. You want to involve them not only when it comes time to publish the report to have them kind of give their rubber stamp, but you want to involve them from the beginning. Incorporate them into asking what sort of research questions should we ask? What are the things that need to be evaluated? Who else should we bring on board? This sort of involvement that is deep and more than just superficial is really what we want to do for those who are influential and interested, because they're going to have a lot of ability to impact what happens with your results in the end. And so adding credibility to your research findings or to your evaluation report will ultimately rely on how well you involved those influential and interested groups. And then sometimes you have people who are very interested and not influential. They don't have a lot of ability to impact the program. Generally, the strategy that's recommended for them, while you might involve some of them, of course you can't involve everybody in the decision-making world. And so sometimes your goal is just to inform them and to keep them up to date, keep them aware so that they don't kind of worry about what's going on. And so that's kind of a basic stakeholder analysis. Now, as you think about the kind of last P, if we just go back to the principal investigators. Now, a lot of research is investigator-driven. This is especially true in academic research, where the principal investigator is the one driving the research. But in public health, a lot of research and evaluation is actually driven by what we call the sponsor or executive sponsor. And so sponsors are one of the most important stakeholders in your program. They're usually the ones who are going to make decisions based on the evaluation that you provide. You're going to provide them with decision, and they're going to or you're going to provide them with evidence, and they're going to make a decision based on that. And so it's really important that your relationship with your sponsor is well defined and articulated, and that your responsibilities, what you're going to deliver to them, how you're going to keep them informed throughout the process, is all kind of stringently defined. Now, in the textbook, we do talk about terms of reference, which is a key strategy to help kind of articulate the relationship and responsibilities. Now, I thought about, in developing an evaluation proposal, which is the final assignment of this course, I thought about using it as a strict terms of reference document to ask you to develop a terms of reference document. Ultimately, I decided to give you a bit more flexibility because I think it's important to recognize that not every relationship with a sponsor is going to be governed by terms of reference. Sometimes you'll be conducting an evaluation as a member or as an employee of that organization, in which case the terms of reference may be overly formal. And so this depends a lot on like the workplace culture of where you work. But terms of reference are a great strategy, because if you can get a lot of the decisions documented ahead of time, then it's a good way to make sure that the evaluation kind of runs smoothly, that people who kind of disagree with certain aspects have something to refer back to or something to think about. It also provides you with an opportunity to begin thinking through many of the issues that you'll face in evaluation right from the start. And so there's quite an extensive checklist on the UNEG quality checklist for terms of reference used in an evaluation. And I encourage you to look at those. The other tool that we're going to talk about today is the stakeholder matrix. Now, most evaluations will include some sort of stakeholder matrix. And so before we kind of move into what a stakeholders matrix are, or maybe talking a bit about more of that, I just want to cover the basic things that are in a terms of reference document. And so this includes like the evaluation purpose, which says why it's being done, how the results of it will be used, the objectives, which are kind of the SMART objectives that you have already developed for your proposal. The evaluation context, sometimes this will be something like a PESTEL analysis, which looks at the political, environmental, technological, sort of context in which an evaluation is being conducted. It's one of the preliminary evaluation strategies that we'll cover here in a little bit, and that is talked about more extensively in your textbook and in the example reading. But sometimes this might not use a formal preliminary analysis method like PESTEL. Maybe it just covers more superficial things that you're concerned with about, what kind of the context environment is. So maybe you're reporting on, what is the current prevalence of a certain outcome and what are you hoping to achieve. This kind of leads into the scope, and so it's important to define the scope of an evaluation. As you experienced in kind of developing the process outcomes and impacts of your evaluation, and identifying what is being evaluated, defining your scope will help you to understand when you're going to conduct which types of evaluation. Now, as you've read the difference kind of between outcomes and impact evaluation, which you'll discuss more in a later chapter as well, sometimes it's not always possible to have a scope of doing impacts. Sometimes evaluations are given, 6 months, a year, 2 years to run their course. It's not always the case that you'll have 5, 10, 15, 20 years to look at an impact to see, kind of what the impact of your program was in the long term. And so in these cases, that scope needs to clarify that. Is the scope just a 6-month quick rapid analysis of, employee preferences around, procedures or something, or is it something more long-term, saying what is the population impact of a cognitive behavioral intervention, developed, through an app or something. It's also important to think about what criteria you're going to judge something on. Remember, we've talked about this distinction between evaluation and research, being that evaluations help us to judge the value of something, and of course, value is incredibly subjective. Value isn't just dollars and cents. It's not just morbidity and mortality rates declining. You need to work with the sponsor to identify what are the criteria, what are the conditions that you will use and judge as being the important defining qualities of how you judge the value of a program. And then do the analyses that's required to help them, evaluate those criteria. And this will include creations of kind of tailored evaluation questions. In the textbook, you were kind of introduced to these PICOs and spider frameworks, which are just a way of identifying specific topic areas or specific research questions that are detailed enough for you to be able to kind of narrow the view and scope and objectives of your analyses. And so those evaluation questions will be tailored to kind of the research questions of what you hope to achieve, and then your methods will explain how you're going to achieve those, address those questions, including, what sort of, are you going to use quantitative, qualitative, mixed method? Who's going to participate? Are you going to interview employees? Are you going to interview the general public? Are you going to do a survey? All those sort of things would fall under kind of methodology to answer your tailored evaluation questions. And then in addition to kind of the methodology of your kind of research and evaluation process, there's also the evaluation work plan, which needs to be addressed. And so that's how will you actually manage and govern the work of your evaluation. You know, who are you going to report things to? Who is going to be the person responsible and accountable for different components of the evaluation? Who's going to be responsible for leading it? And so that work plan will help you kind of work some of that stuff out. And finally, a good kind of addition to terms of reference is to considering, you know, how does this affect people across gender, ethnicity, you know, indigeneity, all of these aspects that are important to gender and human rights, and how will those interests be taken into account? Some of this might be covered in criteria. You know, if you're working with an organization that works with the elderly, for example, definitely there's going to be thought and consideration around, you know, human rights of the elderly being balanced against things like cost and resource intensity in helping elderly people. And so incorporating that as kind of like an encapsulating idea as gender and human rights, I think is an important feature, even though that may appear in other areas of the terms of reference. So hopefully that gives you a bit of a broad view of what terms of reference are. You can look at the terms of reference checklist to kind of see subheadings in that category of what is included in kind of a good thorough. Now, not all terms of reference are like this, and sometimes you're kind of shoehorned into working with whatever framework terms of reference your organization already uses. But these are kind of generally good things to try to consider. Kind of a pared down version of the terms of reference is a stakeholder matrix. Now, the stakeholder matrix goal, again, is to identify who the key people are, what their role and influence is, what they're interested in, and how you're going to engage them. Most of the time, it will also include a contact person, you know, the phone, email, web address of a specific contact at a stakeholder organization. And this just makes sure that if something were to happen or, you know, roles change, that there is kind of a documented record of who to contact for what and that sort of thing, so that these things can be handed off easily and that sort of thing. So a stakeholder analysis matrix is really a kind of a life-saving tool in a lot of those situations in which, you know, maybe there's a change in management of the evaluation or something like that. And so keeping this material together is important because it, A, provides a good documentation record of who was involved, how they were involved, how the decisions to involve them were considered and arrived at. And then there's also just the technical aspect of you need a list of email addresses so that you're able to contact, you know, the stakeholders, you know, kind of who maybe you want to keep monitoring or keep a tab on versus those who you want to kind of be involving throughout the process. And so you don't lose track of people. I've had, you know, of course, experiences in doing my own research and evaluation where maybe you've involved a stakeholder early on, but then, you know, kind of things evolve. And then when you've kind of put together your final list of people who, you know, are going to be on a grant or something, you know, maybe you've left somebody off because you didn't have them in any sort of formal stakeholder analysis matrix. And so this is really good best practice to include in your evaluation plan, so that you can, A, identify additional people who may not have been identified before when kind of finalizing your evaluation plan with your sponsor. And so a stakeholder matrix, again, you'll create this stakeholder matrix as part of this week's assignment, and that'll be kind of the capstone project for this week. In doing so, I want you to use the 7 P's framework to try to identify you know, the patients, the public, the providers, the purchasers, payers, policymakers, product makers, and principal investigators or sponsors of your project. You can even include a column that says which of those they are. You know, are they a provider, are they a purchaser, are they a payer? So that's certainly very helpful because in step 5, you know, you consolidate steps 1 through 4. So that's a good way to show that you've done step 1. I would try to identify at least one person from each of those categories or one group. Sometimes you're not able to identify a specific person. If that's the case, that's fine. We're not gonna, you know, we're not gonna take you off points for that. But we do want you to try to thoroughly think through, you know, who are the purchasers, who are the payers. I think those are often the hardest categories to do. Also, maybe product makers. You know, if you're doing something like HIV or STI testing, product makers might be like Insti or whoever the company, the biomedical company that makes the testing equipment is. If you're doing something like Housing First, product makers might be who are the providers of housing, landlords and that sort of things, actual construction companies, all those sort of things of potential products. This is very variable depending on the specific context, and so you're also gonna have to take a bit of creative liberty, but try to take it seriously in identifying people who you think could actually be real stakeholders. Try to think of it in terms of what you would actually do in a real analysis or in a real kind of planning, implementation, and evaluation framework. The step 2 is to describe each of the stakeholders and what you think their primary interests are for. You also want to talk about whether or not they should be monitored, informed, consulted, or involved, which are the kind of 2x2 framework that we discussed earlier. And then also explain how you will monitor them. If you've said somebody's going to be monitored, does that mean quarterly emails? Does that mean you're just going to check in, see if they've said anything on social media, that might be interest? Are you going to, relook at the stakeholder analysis every 6 months, or however you choose to monitor it is ultimately up to you. But try to think through the best thing to do for that group. Also, inform is going to look different for each organization. Some stakeholders you might inform with a formal report. Some people you might inform by going to lunch with. How you're going to consult, are you going to do a formal consulting like a focus group or qualitative interview or surveys, or are you going to do kind of informal consulting? And is it going to be you, the evaluator, or do you have kind of an emissary, somebody you're working with who maybe has a closer relationship with those stakeholders? And maybe there'll be some sort of informal consulting as well. And then involvement's probably the one you're going to want to be most detailed about. And this goes into, how are they going to be involved in the project and engaged throughout? I would think about multiple stages. Don't just involve people, kind of at the end, in reviewing the final recommendations report or something, but also make sure that they're involved in all the key moments throughout an evaluation. Finally, you're just going to put together that in a stakeholder matrix. What exactly is in that stakeholder matrix? I'll leave it largely up to you. There is an example. That bottom left table 1 stakeholder matrix is included in the outline guide. And there we just have, what the stakeholders organization is. That's the 1, 2, 3 through 8. Who the contact person is, what is their role, influence, and interest, and how will you engage them. You're perfectly welcome to organize that in a different way. Just make sure that when we go to grade, all of those kind of details are there. Okay, so in kind of getting more into preliminary evaluations, I think, as I said kind of at the outset, this is where a lot of your work is going to focus on what's in the textbook and what's in the readings. But I did want to just have a little bit of a discussion around when you use these various methodologies. You needn't necessarily be an expert in each of these methodologies. I think for the sake of like the test or the quiz number 1, which this will be tested on, I think you need to be able to recognize basically what is being done. If I describe a scenario, what is being done, or if I say, I'm deciding between these 2 methods, which do you think will be cheaper or something like that. So just kind of trying to understand a bit around what they entail, a bit of a broad overview. You're not necessarily going to have to replicate these. The other reason I wanted to provide these examples of methods is because I think they're good for helping you think through your final evaluation project, and potentially even projects that you'll do as part of a practicum or in your kind of workplace. The first one we kind of talked about is the document review. This is good for when you're working with internal documents or data, so it's low resource intensity, right? It doesn't require a whole big staff to conduct. It largely requires you being able to sit down with either an internal data set, so maybe that's like number of hospitalizations if you're working for a hospital, or maybe a balance sheet looking at, how much should we spend on XYZ, because that can help you understand a lot about the inner workings of an organization. Documents may range from stuff on people's websites all the way to annual reports to meetings of minutes, just so you can get an understanding of that kind of internal setting nature of an organization. And so when you've got those internal documents and data, you can conduct a document review. If you're looking more at practices, at how things work, about how things functions, a process, for example, an example of this might be, say you want to look at the internal practices of what it takes to enroll in a healthcare program. And so maybe that requires, somebody to come in, complete a quick screening interview or survey or document or form, and then that has to be processed by so-and-so, maybe it has to be reviewed by a general manager, and so this is kind of a whole process. So if you're thinking about planning an implementation to replace that process or to make it better or to implement a whole new process, looking through a task analysis or cognitive task analysis can help you chart step by step what is being done or what is required to be done and able to accomplish a specific task. And so you might actually remember doing basically rudimentary task analyses in early years of education, such as like, how do you make a peanut butter sandwich? And it's like, A, pull out the peanut butter. B, pull out the jelly. C, pull out the bread. D, open the bread, open the peanut butter, open the jelly, get a knife, spread it, right? That sort of detailed step-by-step description of what is required is actually very helpful, especially when you start dealing with complex things like accessing medical care. If you think about getting to the hospital, right? Say you need a surgery on a knee or something, right? That's a whole big process because it requires specific people to contact patients, tell them when to come in. If there are emergencies arise, you need to handle how prioritization works, and how people are going to get to the hospital if they are kind of being notified on short notice about how to get to the hospital, how they get home from the hospital. And so task analysis can help you think about that, not only from the perspective of the person conducting the task, but from the perspectives of all those people involved in the tasks. And so this has been sometimes increasingly treated as a qualitative method called journey mapping or participant journey mapping or patient journey mapping from the patient perspective. And so task analysis tends to be more from the internal perspective, but can also be looked at from the patient perspective as kind of a patient journey analysis. Sometimes also you're looking at external documents and data. You're looking at what other jurisdictions are doing. This is kind of called a jurisdictional scan. So say you're implementing, an STI clinic, looking at how that is done in other cities that are similar to yours is good. So that's basically the gist of a jurisdictional scan. These are important because politicians, leaders, decision makers oftentimes don't like to be the first one to do something. They like being comforted that, oh, this has been done somewhere else, this has shown to be effective somewhere else, or this is working well in XYZ. And so having that jurisdictional scan can definitely help a decision maker be a little bit more courageous in their decision making. You can also rely on kind of academic sources. That's kind of your traditional literature review. I imagine at this point in your training, most of you have conducted either like a scoping review or a systematic review. There are also meta-analyses, which some of us may be familiar with, some of us may be less familiar with, but ultimately all of those just rely on what is published in the academic literature. Sometimes literature reviews will include gray literature, sometimes not. The important thing to remember is that you're reviewing kind of published, peer-reviewed evidence. And I think all of you at this point have had experience in kind of doing at least a little bit of literature review. And so that's a very standard process in the public health world for people at health organizations to be doing a rapid literature review. It might not be the same kind of formalized process that you see in published reports, but definitely we do literature reviews as a way to understand what is being done, what is being said, and what does the evidence say. You can also consult directly with experts. This is through things like the Delphi method. Now, the Delphi method is just one way of consultations. There's a whole list of kind of those participatory activities, which can also work with experts, right? Experts don't need kind of boring, complex methods to consult them. You can use any of, in the appendix, we have all these lists of participatory activities. I encourage you to look at the appendix. I think when you get to the qualitative research section, that's when the appendix will become very useful because it has a lot of great ideas, talking just very briefly about various engagement strategies. Also, when engaging. I think the creation of mind maps, which is kind of one of those participatory activities, is really useful to have people chart out how they think about things, what they think about the relationship of things. And then there's also the more formal method we talked about structured conceptualization in the chapter. And so Delphi method tends to work best on experts, but many of these participatory activities can be used to consult either experts or the public. Finally, in looking at the environmental context and situation, if you're concerned with some sort of geographic element, then community mapping is good for that. So to understand, where do people go for STI services? Doing a community map to see where all the STI services are, what people consider as being an STI service. Is that just my doctor's office? Is that a specialized clinic that targets a specific population like me, or is it something different? Or to understand, say you're studying like how people engage with police officers, looking at where police officers are in the neighborhood, asking people where do the police officers quote unquote hang out? Are they hanging around safe consumption sites? People who use drugs hang out. So kind of understanding that community map, that geographic aspect is something that oftentimes you're very concerned with. Things like safe consumption sites, I think that's really important for. But of course, you can also be concerned with that external and internal environment, context, or situation. And you can look at like a pastel scan or SWOT analysis. Now the pastel scan, that's often looking at more external factors, and the SWOT analysis, which is the strengths of your organization, weaknesses, opportunities, and threats, that's more looking from an internal perspective. And so some of these have tendencies to be used for a specific thing, but I wouldn't be afraid, as I said, to mix and match to find the shoe that fits. Just make sure that as you do, you're able to kind of give a good explanation of where the methods came from, what they're used for, how you're mixing them, and how that's still a legitimate method, because you want to make sure that people have trust in kind of the work that you're doing. And so, as I've kind of mentioned before, these are only a subset of the many methods that you might use in the course of preliminary evaluation. But using them to think out and to plan ahead, I think they're all really great and fantastic methods for that. As I said, you can also mix methods. The two on this list that probably get mixed the most are the SWOT and PASTEL, where you look through the strengths, weaknesses, opportunities, and threats within each of the political, economic, sociological, technological, legal, and environmental conditions. And so you can definitely use those kind of mixed methods frameworks a little bit. This isn't necessarily what I consider classical mixed methods, but that idea of being creative and trying to identify what works best for you, what works best for your stakeholders, what is still going to be viewed as credible, I think is an important thing. And it's what makes you experts, is that ability to say, okay, I see this method and this piece is going to work well here, and over here there's this method and that piece is going to work well. And bringing those together in a way that is useful for you and your stakeholders to get the information that you need to assess the value is really what evaluation is all about. And so that's the end of the content for this week. Next week, we're going to talk about process evaluations. So I look forward to seeing you on the discussion boards. If you have any questions, if something in the video wasn't clear, or if you want additional information about something, please post there. I think you guys have asked a lot of great questions already so far, and so thank you for being engaged. It's definitely important for an online class for that kind of open dialogue and communication to happen, because I know sometimes I end up feeling, like, oh, is the course going all right? Well, it's hard to tell unless I hear from you guys. So it is good to hear from you in the discussion boards. So please reach out there. And otherwise, we will see you with next week's content on process evaluations. Okay, take care and good luck with your stakeholder analysis assignment this week.